Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Hello, and welcome to Talking Head Pain, a podcast that confronts head pain head-on. I'm here live at the American Headache Society's scientific meeting. This is Joe Coe, and I'm here with a very special guest. Can you state your name and affiliation?
My name is Chris Gottschalk. I'm the director of headache medicine and the headache medicine training program at Yale University.
And what was the most interesting or impactful thing that you're taking away from this meeting?
Two things I'd say. I was reminded from the discussion between Drs. Burstein and Goldsby that there is a study out now that shows that the longer you take an anti-CGRP drug, the less often you are going to have prodromal symptoms, and the less often, even if you have prodromal symptoms, you will get a headache as a result. So that's the first time that I'd seen a study which tracks not just the FDA mandated measure of how many days do you have a headache, but actually looked at the evolution of how phases of migraine shift in relation to being on a good treatment for a longer period of time. And I think that's the kind of thing we really need to focus on in the future. There is increasingly attention paid to other measures of benefit of these treatments, like quality of life in various ways and cognitive function, all of those things that really end up mattering to people on a day-to-day basis, well beyond whether or not you have a headache, which is sort of the least important thing in the long run. So I just thought that seeing that in real time, that people are starting to focus on a much broader picture of impact of migraine, how to measure it, and that the treatments that we're using are actually having significant effects on many of those things well beyond how much headache you actually have, was kind of cool.
Can you just explain what prodrome is for folks that might not know?
Sure. So prodrome is the term we currently use for symptoms that emerge hours or days before a migraine attack, but that are linked to the migraine attack itself. So that could be yawning, it could be being foggy-headed, it could be being irritable or sensitive to smells or lights, many different shifts that occur in that hours to 48 hours before. But for me, the revelation there is that what we used to call triggers are really much better understood as when you're about to get a migraine, you get sensitive to what's around you, and that's the right explanation for what otherwise would be called a trigger.
Very helpful. And you mentioned there was one other thing that you wanted to share?
So I'm now the co-chair of the Fellowship Program Directors Committee, which I've been a member of for a while. But what's really exciting there is the fact that we looked over the recent 10-year history of this committee, and that when it started 10 years ago, there were 4 headache medicine fellowship training programs in the country, and there are now 56.
Amazing.
So the idea that we are really, really taking leaps and bounds in addressing the lack of the supply of headache medicine trained people, that we're getting more and more involvement in research from these fellows, that we're getting more and more interest from the neurology field. And we're also talking about things like formalizing the path to train non-neurologists, right? We all know that we would like to see GYN doctors and ENT doctors and internal medicine doctors who are experts in headache because they see more of these patients than we do.
Absolutely. Well, thank you so much for your time.
You too.
Thank you for listening to this episode of Talking Head Pain, the podcast that confronts head pain head-on. If you have any questions, thoughts, or suggestions for us, you can send us an email at podcast@ghlf.org. If you enjoyed this episode, please give it an honest 5-star rating, write a positive review, and spread the word by sharing it with your friends and family. It'll help more people like you find us. I'm Joe Coe, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.